guys. Devin Morgan, lead physical therapist, Colorado Pain Care Physical Therapy. We're going to do a couple tests with Colleen here, some things you can do at home that'll help you figure out if you have a problem with your back, or if it's something that you can fix on your own, or you need a little assistance along the way. We're going to take Colleen through 4 quick tests and then give you a little bit of information about them all. First thing I'm going to have Colleen do, stand nice and tall for me, hands at your side, Colleen, feet about shoulder width apart, and then I want you to slide your hands down your thighs like you're trying to put your palms onto the floor. Now, as someone does this, if they do have a back pathology, they're likely going to feel a little discomfort in the band across their low back as they commence that motion. Some people feel at the beginning, some people feel at the bottom, but somewhere in that transition period is where you're most likely to feel it. Some people, if the issue is bad enough, they will feel pain radiate down the legs as well and not just in the back. If any of that happens to you, you probably have some back pathology in some way. Go ahead and stand up, Colleen. The next thing I'm going to have Colleen do is extend her spine in a standing position. Place your hands on the top of your glutes and then push your hips forward and try to lean back as far as you can. A lot of people with back pathology are very limited in this range of motion. So Colleen can go pretty distance here. Now Colleen, show them what it normally looks like if someone has a back problem. About right there. Someone with a disc issue or some type of facet irritation, that's not going to be a comfortable position, at least not at first. It's often used in treatment, but we have to get the body to accept that type of treatment first. If you hop right into that motion, you're usually going to have a restriction and some pain accordingly. Oftentimes that pain with this motion is directly in the low back. Sometimes that runs down the legs as well. Either of those would be a positive for back pathology. So 2 more tests for Colleen's back to see how healthy it is. What I'm going to have you do now, Colleen, is put your hands on your hips. And then from that position, I want you to push your hip to the right as far as you can while leaning to the left. Go until you feel a stretch along this outside. Anyone with a back pathology is likely to experience some central back pain, or possibly pain off to the left or right with this. The pain usually occurs in range of motion, so as Colleen returns to normal, it usually subsides. If the condition is bad enough, go ahead and go to the other side. So she's doing the same test for the other side of her back. If the condition is bad enough, sometimes this does elicit a response where you have pain running down the back of the leg as well. Most likely it's local back pain, but again, it usually subsides as soon as the patient stands up straight again. Go ahead and stand up. If either of those 4 motions cause complications for you symptom-wise, you likely already have a current back issue or some type of physical limitation that could eventually lead into something that needs treatment. If you have any questions about these or need help with any of your current issues, call 303-GOT-PAIN and schedule an evaluation today.